My belief is in the blood and flesh as being wiser than the intellect. The body unconscious is where life bubbles up in us. It is how we know that we are alive to the depths of our souls and in touch somewhere with the vivid reaches of the cosmos. This is me. This is my body fighting to stay alive. We tend not to look at the body and question how much trauma remains inside. Or how would the body respond if it was allowed to self-correct trauma? But these were questions I was confronted with after surviving such a near-death injury. What you're witnessing here is my body implicitly and intelligently moving toward stored trauma through the felt sense. It's working through unhealthy layers of dissociation that remain stored inside. This is the body communicating with the past, telling the trauma stored deep within the nervous system, there's a way out of this. It's possible to move on from this. This is a preview of a psychedelic somatic interactional therapy session, or PSIP for short, and how this work can help the nervous system process trauma and move toward the solution of recovery, versus staying stagnant in the past, frozen in the past. This combination of somatic therapy and psychedelics enables us to access deeply unprocessed material, things the mind alone cannot resolve. These movements you see are not consciously organized or rehearsed. They're not coming from the mind. For many of us, we become so wedded to our thoughts that we don't even really know about the felt sense within and its self-correcting abilities. Because we're so analytical, we kind of miss out on the possibility of discovering this deeper sense. It's not that we don't know it's there, we just don't know how to tune in or become attuned. It's almost like the mind doesn't want to find out that something is as powerful, if not even more powerful, than the thoughts, the reasonings, the assumptions that we make. This might be our deepest blind spot, and it's right under our noses, right inside of ourselves. Hi, my name is Todd Brossart, founder of Somacology. I'm a psychotherapist, and what really excites me as we move into the future, it's the transformative potential of psychedelic therapies. I'm a trained psychedelic somatic interactional therapist, often referred to as PSIP for short. This work has completely changed how I approach my work personally and professionally. It's changed my life and the depths to which I feel things, how I feel things, and how I get unstuck. Before a near-death injury changed my life in 2019, things were moving along fairly well. I earned my master's degree in social work in 2008, spent 12 years working at the VA outpatient mental health clinic, and then an on-the-job injury landed me in the hospital for a month. There's nothing quite like hearing a surgeon say, if we don't operate now, your chances of survival are grim. And actually, I don't really remember much of that. It was kind of fits and spells. But after getting out of the hospital, I'll say, in some ways it was more difficult than what was endured in the hospital. I'm happy to share more about that through our time on the Somacology channel. But after getting out, I became a guinea pig for restoring my health and facing some big questions. Like, what does true healing look like? What does it feel like? And what really works for repairing trauma? And what parts of myself did I actually leave on the table, coming so close to death? You know, in the aftermath, after getting out, I tried several different types of modalities, and responses were at best marginal. I tried talk therapy, and I will say, being a therapist, we're not always the great patients. I moved into transpersonal psychedelic experiences, and there was some unlocking, sure, but it was still kind of distant in terms of what I was feeling, what I was trying to integrate. I even tried EMDR. And while there were some improvements, my body still felt disconnected and really at odds with itself. And then I found, through accident, the psychedelic somatic interactional therapy modality, PSIP. And after receiving one session, I was blown away by what happened with such an embodied approach with a low dose of psychedelics on board. For the first time, I felt my body actively integrating the trauma, like actually moving and pushing and allowing, but in a gentle way, a subtle way. It was moving through the pain and finding calm. And that was an iterative process over a number of sessions. And that one experience led me to join up and become an apprentice in this modality. And that's been over the last couple of years now. And at this point, I'm on track to become an instructor myself because I see such a generative power with the PSIP modality. But I don't believe it's all just embodied approaches. I do think we need to wrestle with the mind and challenge our everyday reasons that so often get us stuck in our own logic that is anything but. It's illogical. So this channel, Somacology, it's an exploration, much of it stemming from my own personal experience and the challenges that come from incorporating and integrating a near-death experience. This channel is all about how we as people might better restore the connection between our bodies and minds to become more fully human and realize a greater potential. With Somacology, we're exploring the relationship between body and mind. We're going to be exploring psychedelic therapies. We're going to be looking into mindfulness practices while creating a life that is hopefully more satisfying than the one you're living now. So to me, Somacology is based on a simple premise. Like a natural ecosystem, your body is constantly adapting to its environments. And at times, we can lose track of the innate connections between body and mind. So Soma means the body of an organism. And ology means the study of something. Your body and mind are a powerful ecology, a dynamic, self-sustaining system where countless interactions shape health and well-being. So you are not just thoughts, not just feelings or sensations, and yet we often relate to these inner experiences as separate. Yet likely is the case that there is a more complete you out there. And it's learning to orient these experiences with more fluidity, to feel more human and more resilient. There's a lot we can do to get back on track in restoring these internal connections, and it usually starts with paying attention to the small things, not just the significant, but the subtle stuff. So modern life, though, with all of its dogmas, it has proven that if we stay mindless to it, it will make us sick and detached from ourselves. So you and me and we all need to stop overriding our biology and getting stuck in thought loops and avoiding really what's stored inside. Because here's the truth. You can't escape your biology, no matter how hard you try. And ruminative thinking, rumination, it tends to lead to an increased detachment in some way, an increased isolation. I see so many people mistake the pursuit of feeling good as the pathway to healing and growth. While certainly there's temporary relief, it can be helpful and resourceful. I get that. Yet feelings, as we know, are not lasting. It's this feel-good agenda. True healing and growth requires something deeper. We need to feel things more deeply, more completely, especially the feelings and sensations we've spent so much time avoiding. Healing also requires us to think more accurately, questioning our assumptions and testing them out rigorously. We tend to live in our own little narratives and beliefs and stories that we see as objective reality or fact, and yet it's nothing but. Healing, I want you to know, isn't just a concept or a declaration, it's a process, and it begins with acts of repair. Psychedelic therapies are going to continue to increase in popularity over the next decade, and I know they're all the rage right now. And while I believe in psychedelics, and when used ethically, they can be an integral part of healing and growth and just improving our mental health. And based upon my own experience, though, I'm not sure I'll ever believe in a magic pill. What I will say, though, is that it's been my experience that psychedelic-assisted therapies, they offer a working window that opens us up to where real work is awaiting us, often showing us what updates are needed in how we perceive reality, in how we can be more flexible living in our ordinary state of consciousness. I believe we need to approach healing with equal parts patience and ambition, balancing our work with the curiosity of a scientific mindset, but also with the heart and openness of an artist. So if you're curious about how to deeply process trauma, interested in psychedelic therapies, mindfulness practices, and integration strategies, then I think you're in the right place. That really is the mission of this channel, is to empower you to become a better steward of your health, to help you engage more deeply with your physical, emotional, and psychological worlds, and to make these parts of yourself more fluid with each other. So if you identify as someone ambitious about becoming a better steward and, scholar of your health, then welcome to the Somacology channel. Let's get to work.